Your mother's even more proud now, I'm sure. Thank you very much for that, Evan. Damon Barrett has come a long way to be with us tonight. He is a co-founder and project director at the International Center on Human Rights and Drug Policy. It's dedicated to developing and promoting innovative and high-quality legal and human rights scholarship on issues related to drug laws, policy, and enforcement. Its academic home is at the Irish Centre for Human Rights at National University of Ireland, Galway. Just to tell you a bit about Damon, he is a senior human rights analyst at Harm Reduction International. It's a London-based NGO working to reduce negative health, social, and human rights impacts of drug use and drug policy. He's a member of the UK delegation to the UN Commission on Narcotic Drugs from 2008 to 2011. He's been involved in that. He's worked to improve the focus on human rights and drug policy at the UN Human Rights Council and with human rights bodies. He's a very busy guy. He's also the editor of the recent book, Children of the Drug War, Perspectives on the Impact of Drug Policies on Young People. Please welcome, all the way from Ireland, Damon Barrett.
Right, so I have to use this clunky old thing. I think in the age of the iPad, this looks like a Bakelite phone at this point. It's yeah. So I actually came from London this time because that's where I live and work. But we do have our centre in Galway, and affiliations with different universities around the world. So firstly, anyway, I'd like to thank Evan and I'd like to thank the Stop the Violence Coalition for inviting me. I've never been to Vancouver before, which working in harm reduction I think is a little bit odd because we talk about Vancouver so often. But I remember I think it was maybe my first harm reduction conference, Donald McPherson told me I should come to Vancouver, so eventually I'm here. One of my focus areas at Harm Reduction International is human rights. I lead the human rights team. There's 3 of us now, which is great. And what I do there is I try and focus as well on drugs and the rights of the child. So, when it comes to drug policy discussions, people say, someone has to think of the kids. So, all right, I will. A little while ago, I was in Colombia. I went on a delegation down there to look at the effects of aerial fumigation of coca. And I was in a place called Guaviare, and there I found myself with a lot of other people talking to a bunch of children, these children that were in a priest's house, and what they were being was educated and housed and sheltered and clothed by this priest because they'd all been displaced from their homes because of drug-related violence and because of the fumigation campaigns. And the phrase "children of the drug war" popped into my head, and I thought, okay, well, this is something I might have to look at a little bit more, and like every good policy nerd, I went and did a book about it. And the book is called Children of the Drug War. It's not my book. It's a collection of essays from around the world. And it's, we've essays from Afghanistan and Mexico and Colombia and from Serbia, the UK, Canada, the United States. And through all this work, there's just one thing that springs to my mind, and I don't think I can get around this, is that one of the greatest myths of drug prohibition is that it protects children. The thing is, it's a necessary myth when one of your core justifications for what you're doing is the protection of children. Nixon did this in 1971 when he coined the phrase, the war on drugs, or when he officially kind of launched it. He said that addiction comes into homes and destroys families, and he talked about the threat to children and youth. And for those of you who know this kind of stuff, the 1988 UN Drug Trafficking Convention talks about the threat to children. It talks about a danger of incalculable gravity when children are used as a drugs market or involved in the drug trade. Now, the thing is, imagine you're a politician. President Calderon has said this. He's talked about protecting children from drugs as one of the justifications for the military campaign. I remember a minister for health and human rights in Indonesia talking about the protection of children from drugs when they were instituting a new drug law, which included the death penalty for drugs and imprisoning parents if they don't report their children's drug use and this kind of nonsense. Imagine if you're a politician and you've kind of staked your policy on that, and then the justification turns out to be false. Imagine we're talking about a world where our drug policies protect children. Imagine a world where children lose parents to incarceration on massive scales, or where children spend the first years of their life in jail because their parent or their mother, in most cases, committed a drug offence, or where children are born when their mother's shackled to a bed because they're drug users, or families have their benefits taken away or their social housing because of a felony drug conviction. Or where despite, no matter what we do in relation to drug policies, children still experience neglect and abuse because of parental drug dependence. And no matter what you do with your drug policies, that's going to keep happening. What about where children are at the forefront of militarized drug wars, where they're involved in the fighting, where they're experiencing grotesque violence, where they're stepping outside their schools, looking up and seeing helicopter gunships accompanying a plane which is spraying an unknown chemical on their skin and on their families' crops? And imagine a world in which more children than ever are using the very drugs that we're talking about, and where it's easier to get than ever. Imagine that world, right? It's not that difficult, actually. It's not politically sustainable if you admit that that is part and parcel of the policy. You have to say that prohibition protects children. And that's what the refrain becomes. Now, I know a lot of what I just said there is kind of remote to British Columbia, and a lot of that's not going on here. But then let's bring it back to the point here and what the talk is about. Does cannabis prohibition protect children? That's a valid question, and depending on my tone of voice, you'll see what I think about the answer. But I was reading that Families First agenda, by the Premier Clark, and it talks about results and accountability. I say, okay, fine, I really like that. That's great. Results and accountability. Does cannabis prohibition protect children? How? And what metrics do you use to decide that? Because the justification is valid. I have 2 children. I can think of no better justification for any drug policy or intervention than to protect children from drugs or drug-related harms. But how? How do you show it? I mean, what we've kind of created is some kind of a positive feedback loop where means and ends in this whole thing have become so conflated. I don't know where one ends and the other begins, Criminalization of cannabis or any other drug you want to think about has become like an end in itself. You've got it's proof without more that children are being protected, and I don't think that's good enough. I want to see something else. I want to see, what are we protecting children from and in what way? And the debates then around how we protect children, the debates for all that have to start at local level, which is why I'd fly across the Atlantic to something like this rather than to a big international meeting, where my colleagues currently are actually. They're in Malaysia at a drugs meeting, and they're talking about judicial corporal punishment for drug offences, which is also imposed on children. What a great way to protect them. Insight is an example of this, right? Insight is about stretching what was considered maybe permissible in order to do what was right for the community in which it's in. Portugal's decriminalisation from 10 years ago. I mean, again, that's on the international stage still quite controversial. You got Switzerland, you got safe injection facilities in Switzerland and heroin prescription programs there. You've got Bolivia and traditional uses of coca. You've got Ecuador and amnesties for drug mules, and you've got Netherlands and their coffee shop models. These are kind of local solutions for local problems. So what's BC's solution? And you know what joins all those things up? They can show results, and they can be held accountable for those results. That's definitely what Insight does. I heard today that there's been 1 million injections there since it started up, and not a single death from overdose, right? That's results, as far as I can see. And that's protecting people. So, these are some of the things that go in my mind when people say think about the children. It's like, yeah, do, but how do you measure that? How do you measure that your drug policies are protecting children? But it leads me to another point, which is this. If BC were to legalise and regulate cannabis, it would place Canada at odds with international law. It would, right? It would place Canada in breach of 2 of the international drugs conventions. That's a good thing, right? Because those conventions are flawed. But one of the problems, I hear this argument quite a lot, and I'd argue against it, and I would warn against it, is that people say, well, let's just ignore those drug conventions. Let's pretend they're not there, or let's just take the political fallout, because it's just international law anyway, isn't it? And yeah, but so is nuclear non-proliferation, and so is the Kyoto Protocol, and so is human rights law and the Geneva Conventions and so on. So what we need to be doing is actually making international legal arguments that talk about the need for change to the international drug control regime. I'll join this up with children in a second, but one of the ways to do this is the question of proportionality in human rights law, right? Because a lot of the human rights violations in drug policy don't have to happen. They really don't have to happen, so they're not part of this question for me. But let's take one. Let's take the right to privacy. I can't see any way that you prohibit what somebody does in their own home or in their own bedroom if they're over a certain age, over 21, 30, who cares what it is. Everybody's banned from doing it. There's no way to institute a ban on cannabis, for example, without infringing upon somebody's right to privacy. There's no way to do it. So the question is it a legitimate infringement? right? And it can be if it serves a legitimate aim. So then the question is, okay, what's that? It could be the protection of health. It could be the protection of security. Let's bring it back to my point, and it's the protection of children. And what you have to do has to be, quote unquote, necessary in a democratic society for the achievement of that aim. So it has to not be arbitrary, and it has to be not disproportionate. No more than necessary for the achievement. Have you got less restrictive means for doing this? And all these questions have to be asked. And I just can't find prohibition passing the test. But I'd really like to see it analysed. And again, coming back to those results, right? How do you measure if the policy you've implemented has even the potential to protect children, if that's your legitimate aim, even the potential to do so, to give you that leeway for another 50 years of attempting it, if you can, because we can demonstrate that the stated aims aren't being met, as Evan, I think, clearly showed. I think that's a really important question. I'm going to conclude with a kind of a basic point, I think, before you get to hear from Neill Franklin. Neill's going to get longer time than the rest of us because, for some reason, someone with 30 years of law enforcement experience might possibly have something important to contribute to this debate. The thing is, do we, in 2011, do we really need to have a conversation about what we know, what we have to do to protect children? I mean, do we really have to do that in 2011? I mean, because I'll tell you something, drug policy's got very little to do with it. Very little to do with it indeed. In fact, drug policy just gets in the way of most of it. Cohesive families and education and that kind of stuff. One of the great myths of prohibition is that it protects children. The thing for me is that interrogating that myth is about finding solutions. And that's what I think thinking about the children and drug policy is all about. Thanks.